beauty keeps changing its definition over time with the ongoing trends. In the past 10 years, buttock augmentation has become increasingly popular worldwide, with round, firm buttocks often seen as a symbol of femininity and sensuality. The shape and proportion of buttocks are important factors in an attractive, well proportioned body. Popular tabloid celebrities have fueled the demand for this procedure, resulting in large number of patients requesting buttock enhancement surgery. Buttock augmentation is a body shaping procedure that is designed to redefine a woman's overall physique by enlarging the buttocks and creating a lifted and enhanced contour. So, who are the candidates for buttock augmentation surgery? The shape and proportion of a person's buttocks are largely determined by genetics. Now, your skeletal structure and how your body stores fat, this influences the appearance of the lower body. You may have a healthy body, you may have a healthy weight and toned muscles, but you are unhappy with flat buttocks which lack shape, or you may have depressions around your hip areas which are known as hip dips. Other factors like significant weight fluctuations, hormones, the normal aging process, gravity, childbirth, all of these also can cause change in your body. Collagen and elastin in your tissues, they naturally shift, and when this is combined with an increased fullness in the abdomen or the hip area, it can create a less balanced overall appearance. Your buttocks may seem less round and full, and your waistline is less defined. Buttock augmentation, in such cases, it helps achieve an improved balance of overall figure, correction of asymmetrical buttocks, enhancement of disproportionately small buttocks, a rounder and perkier and a more pronounced buttock, and most important, enhanced self-image. So coming to the procedure, how is buttock augmentation done? Now, buttock augmentation can be done either by using silicone implants or autologous fat. For lean patients who do not have donor areas of fat, implant is the procedure of choice. Incision is made in the gluteal cleft. Intramuscular pocket is created or a subcutaneous pocket is created and the implant is placed in the pocket created. The incisions are closed with absorbable sutures, and since they are in hidden areas, they are not much visible. Now, in patients who have sufficient quantity of fat around the waist, autologous fat grafting achieves a dual purpose of not only giving an enhanced buttock, but also contouring the waist and giving an improved waist-hip ratio and an hourglass figure. Buttock augmentation using fat is what is most popularly called as Brazilian butt lift. First, the fat is harvested from donor areas using microair and Vaser. Now, the importance of the use of these tools in fat harvest, it lies in the fact that they cause minimal damage to the fat cells and thus they improve the viability and survival of these fat cells. And this fat cell is then treated, purified and then retransferred to the buttocks. This we do using a specialized technique which is called expansion vibration lipofilling. Now, what do we do in expansion vibration lipofilling? In this technique, microair is used for fat transfer with the help of a pressure pump. Now, since the device, it keeps vibrating, as it goes inside, it creates space. It causes expansion of the space where the fat is to be transferred. So, since it vibrates, it expands the space and then we transfer fat. The procedure is called expansion vibration lipofilling. Previously, BBL used to be considered an unsafe cosmetic procedure. This was because in order to transfer large amounts of fat, the fat was grafted intramuscular as well, which increased the chances of injury to the vessels, fat embolisms, and increased complications. But now, with expansion vibration lipofilling, since the space is expanded, considerable amount of fat can be grafted subcutaneously only. We do not need to go into the muscle. And there is less chances of complications associated with it. 30 to 40% of the fat may get absorbed over a period of 6 weeks, but whatever remains after that, This is permanent and remains lifelong. Now, what is the recovery like after buttock augmentation procedure? The patient is either discharged in the same evening or next morning. Medications are advised for a period of 5 days. Compression garment is advised for areas from where liposuction has been done in patients of Brazilian butt lift for a period of 6 weeks. Now, an important thing in patients undergoing buttock augmentation surgery is the position. So, the patient is required to sleep in a prone position for a couple of weeks, and he is supposed to sit on specially designed pillows called BBL pillows for a couple of weeks. Swelling and bruising may develop, which takes few weeks to subside. It takes around 6 to 8 months for the swelling to go completely, and this is when your final result is visible. A desired silhouette with the right buttock size and proportion is no longer just a dream, it is an attainable reality. But getting it done from an experienced and trained surgeon reduces your risk of complications and increases the chances of getting a better and longer lasting result. So choose your surgeon wisely. Thank you.